to continue our discussion, so osmotic diuresis or multiple causes. Meaning osmotic diuresis, this is the extraneous excretion of a fluid out of the body. So hypercalcemia, wherein there is what we call a higher amount of calcium inside the body. It will affect also the osmotic pressures. We have decreased protein intake, prolonged excessive water intake, and also the sickle cell disease, multiple myeloma, these are osteolytic neoplasm or abnormal growth of tissues that cause extensive bone damage and even destruction or degradation of the bones. Also yung amyloidosis, wherein there is what we call a starch-like or a carbohydrate deposit in the spleen, kidney, and other parts of the body. So if there is a starch-like or carbohydrates deposit in the kidney, so it will affect already the movement of ions, and especially the excretion of a sodium ion. And we have sarcoidosis. Okay, sarcoidosis, this is a chronic disease in which unknown in origin, there is a it is characterized by the formation of tubercle or parang tuberculosis or lumps in the tissues of the body. And we have also Sjogren syndrome. The Sjogren syndrome, that is a deficiency in the lacrimal fluid in the eyes, or even dryness of the mouth. Okay, and nephrogenic diabetes insipidus, wherein a disease which there is a metabolic disorder in which the patient, produces large amount of dilute urine, okay, due to the deficiency in pituitary hormone. Okay, and even congenital, meaning ng congenital, so it is genetic in origin. So drugs or medications which can cause, we have alcohol, lithium, phenytoin, propoxyphene, sulfonylureas, amphotericin, and colchicine will affect the movement of sodium ion in the body. So skin loss, burns, sweating, and essential hypernatremia. Okay, next, so what are the interventions or medical interventions? So patient should be given intravenous 5% dextrose for acute hypernatremia, half normal saline solution sodium chloride for chronic hypernatremia if unable to tolerate oral water, kasi it will going to increase the volume fluid during excretion process. Okay, so hypokalemia, so there is a deficiency of potassium ion in relation to the body water potassium, so that is less than 3.5 milli equivalent per liter. So metabolic alkalosis often cause potassium depletion. Okay, so it is exacerbated by potassium depletion, wherein there is what we call a lowering amount of potassium in the blood. So extracellular potassium shift is accompanied by the intracellular sodium and hydrogen movement. So extracellular mean there is what we call a sodium potassium pump. So hydrogen ion and sodium ion enters the intracellular, and the potassium ion will exit. Okay, to balance the charges inside and outside of the cells. So hydrogen movement increases serum bicarbonate and concentration, because hydrogen will bond with the carbon dioxide or bicarbonate ions to form bicarbonate. So higher intracellular hydrogen enhances sodium secretion, enhances hydrogen secretion. So we say higher intracellular hydrogen, wherein there are large amount of hydrogen that enters the cytoplasm, and it will increase the hydrogen ion. So hydrogen ion, if there's an increase of hydrogen ion inside the cells, it will lead to increase also the hydrogen potassium exchanger. So more potassium are being more potassium moves out of the cell, so it will lead by potassium depletion. So that is the mechanism of hypokalemia. So there is what we call a abnormal more amount ng hydrogen or sodium ion enters the cytoplasm, then more na naman na potassium ion will leave the intracellular part of the RBC or the cell. So it will lead to hypokalemia already. So common cause of hypokalemia, yung mga dehydrations, vomiting, diarrhea, and even higher hyperaldosteronism, higher aldosterone. Okay, it will lead to more water sodium retention, DKA or diabetic ketoacidosis, deficient in potassium intake, because that is very rare, and complication of acetaminophen overdose. And acetaminophen overdose will lead to exit or push more potassium ion out of the cells. Certain drug like corticosteroid, beta adrenergic agonists, beta blockers, or beta adrenergic antagonists, some antibiotics and antifungal agents will cause also the shifting of the potassium ion out of the cell.